Good morning, friends. Welcome to our next learning session. This is the incidence of 1980s when I was called to see a patient in the lobby of Surya Hotel in South Delhi. The patient was the son-in-law of a very senior but retired doctor from the army in the rank of brigadier. The patient's father was a chief secretary in the then Punjab government. He and his wife were both settled in the United States. The couple had a problem, as is common, and was sitting in the lobby discussing the issue. The boy suddenly felt nauseous and wanted to go to the toilet, but fell down before reaching the toilet and lost his consciousness. I was summoned immediately. I reached there, and by that time the patient, of course, had become conscious. I examined him and found that his pulse is quite rapid and his blood pressure has fallen quite a bit. So I could make it out that he has fallen unconscious because of the sudden hypotension which has developed. And what was the cause of hypertension? Friends, when I asked the detailed history, I came to know that patient knew that he was suffering from peptic ulcer, and this peptic ulcer have become activated and probably bled so much so that his blood pressure fell and he became unconscious. The boy was non-smoker, occasionally used to take a drink, but not in very large amounts. There was no other history contributory towards this thing. So I suggested the patient to be admitted in a nursing home and watch. I did it and found that he is passing semi-solid black tarry stools. This continued for 2 days, and then his stool became little more formed but still black. The fourth day the patient's stool had become formed and the color had also fainted, and by fifth day the stool appeared normal but occult blood was still present. By seventh day there was no occult blood in the stool, as well as on gross appearance stool appeared normal and the patient was also well stabilized. When I admitted the patient, I put the patient on, I started immediately DNS 5%. DNS, I have said before also, is D for dextrose and N for normal, S for saline. It is normal saline. Normal saline means 0.95% of sodium chloride, which is salt, which is common salt, which we use in the kitchens. Common salt, that is called chemically sodium chloride, and it is 0.95% sodium chloride mixed with 5% of glucose per 100 ml of the solution. Then it is called DNS. I started at a rapid rate of about 40 drops per minute, and within 2 hours patient's blood was settled at 120 by 80 millimeter of mercury. Then, as we observed further, I also started the patient injection ranitidine 50 mg twice daily intravenously and continued for next 7 days before I put the patient on oral treatment. The proton pump inhibitors are better for such patients, but those were not available at that time. Therefore, I had to reconcile with ranitidine. That is, ranitidine is ranitidine, which is his H2 receptor blocker, and this decreases the excretion of the acid. Gastrointestinal bleeding can occur because of a number of reasons. One very important reason is peptic ulcer, and two complications of peptic ulcer. You should always remember, bleeding from gastric ulcer, from a peptic ulcer, can be very large and it can be really massive, and secondly, the perforation of peptic ulcer. Both these things you should keep in mind when you are treating a patient with peptic ulcer. Now, what is peptic ulcer? Peptic ulcer is nothing but a wound. Like we have wound on the skin, we have wound in the stomach, in which stomach's underlying the lining membrane of the stomach gets ruptured, and sometimes even deeper tissues can also become involved. But in gastric erosions, only the lining membrane shows tears here and there, and small oozing of blood occurs from there. But if the tear is bigger one, then deeper layer can be involved, in which there are blood vessels, and then it can be really very severe bleeding. The bleeding, if it is oozing, it is small blood, it passes down the intestines, and due to the action of enzymes, it becomes changed in color and ultimately appears as black tarry stools. But if the bleeding is massive, then the patient may vomit red blood and this is called hematemesis, in contrast to hemoptysis, which is coughing of blood. Remember friends, coughing of blood. The blood is coming from the lungs and it is called hemoptysis. HEMOPTYSIS. Hemoptysis is the blood coming from the lungs by coughing, and the hematemesis, HEMETEMESIS, hematemesis is the blood coming in vomiting, and blood which comes in the stool is called melena. Melena is the black blood which comes in the stool, but if red blood comes in the stool, it is called hematochezia. So don't go into too much of details, but you should remember that person can have peptic ulcer, person can have gastric ulcer or duodenal ulcer. Duodenum, again I may tell you, that is the first part of the small intestine, that is called duodenum. It is small part, and this ulcer can be in this, ulcer can be in the stomach, ulcer can be in the even food pipe. So all these are called peptic ulcer. Now I will show you a few diagrams so that you can understand what we are meaning by this thing. Now see, this is very close to your screen. Okay, now I will tell you the structures. This is the big portion you are seeing. This is the stomach. This is the all stomach up to here, and this is the small intestine. This portion is the small intestines. This is the stomach, and this is the food pipe. See, this is the food pipe, this is stomach, and this is the intestine, first part of the intestine. There is a ulcer in the stomach. Here you can see it. The ulcer can be here, it is in the small intestine, and both these are called peptic ulcer, whereas this individually is called duodenal ulcer, this is called gastric ulcer. See another diagram. See the other diagram. This is the stomach which is shown. You can see right from this is all stomach, and this is the intestine, small intestine. See, this is the ulcer in the stomach. This is the ulcer in the stomach, and blood has oozed from this ulcer, and this is all blood present in the stomach. Now, if comes out by vomiting, this will be fresh blood, red blood. But if it passes into the intestines, it will be changed by the action of enzymes, and the person will pass black tarry stools. See, this is the picture. I am keeping close to it so that you can have a better view of the picture. See another diagram. See this diagram. What you see, this is the stomach, this is the intestine, and this is the food pipe, and this is the ulcer. See, this is the ulcer, this is the stomach, and this is the intestine, small intestine, this is the food pipe. Sometimes the bleeding can occur because of a tear in the stomach junction, that is the area of food pipe joining with the stomach, and this occurs because of a sudden jerk due to vomiting or coughing, and the blood is fresh, bright red blood. Usually it is self-limiting condition. Blood stops, it comes once or twice and then it stops of its own. This is called Mallory-Weiss syndrome. I am just mentioning that besides peptic ulcer, what can be the other cause? Then there is another condition in which blood vessels becomes dilated in the region of the stomach and food pipe junction, and the picture is something like this. You see, as if you are seeing a watermelon. Yeah, this is see this. These are like the stripes of a watermelon. These are like the stripes of a watermelon. You can very well see. This is the appearance when you see with gastroscopic. You are peeping into the stomach by passing a tube, that is called gastroscope. These days flexible gastroscopes are there. During our post-graduation we had only metal gastroscopes. They were difficult to pass, but now you have flexible fiber optic gastroscopes. You can pass them easily. Go visualize the stomach. There is a light there and you can see these things in the stomach. This is called ectasia. These are the vascular abnormalities in the wall of the stomach, and blood oozes from them and can cause hematemesis or massive bleeding. So friends, there can be many causes. As I said, one very common cause is the drugs like aspirin and other anti-inflammatory drugs called non-steroidal anti-inflammatory drugs. They can cause mucosal erosions, but here the case is different. It is a case of ulcer. I showed you another case in which the patient was having piles and he was given anti-inflammatory and he developed mucosal bleeding, and this is a case where it is the ulcer which has become activated and caused massive bleeding. So friends, these type of difficult cases you see, and we will keep discussing such cases and try to enlighten you on these. Thank you very much for listening to me. I hope you will continue your support. The most important thing is subscribing the channel. People are getting some difficulties. I got some feedback. They probably either don't have an account on YouTube, or they have forgotten the password, because when you want to subscribe, the YouTube will ask you your will ask you to sign, and for signing you have to put your email address. When you put your email address, you have to put the password. So please be prepared with your email and password, and enter it, subscribe the channel, and of course watch it, like it, and then comment on the channel. Friends, I have repeatedly saying there are many people who are sending me requests on the messenger only, directly, without coming on the Facebook. My answer to all these people is once for all that if you want to come, you should know that what you are going to find here. I am a doctor. I am a qualified specialist from All India Institute of Medical Sciences, and I write blogs and I make these videos so that people get benefit out of these videos. I want to spread medical knowledge. For that purpose I am doing. There is no other purpose involved in this, and therefore if you come prepared that you are to subscribe the channel and comment on the videos. You just can't come in my friendship list to send me pictures or to talk to me on the phone. That is probably the rarest possibility, because I remain so busy I do not pick up the phone. But certainly if you have some genuine problem, you can write it down to me and I will certainly try to clarify. Thank you very much. See you next time with another video.